So now after the intraaxial and the cisternal segment, so this one, cisternal segment, the facial nerve passes through the internal auditory canal and becomes the intratemporal facial nerve. So mnemonics can be helpful, such as I love going to makeover parties. This was taken from Radiopedia. But let me present another way of remembering this. So that intertemporal facial nerve here courses the bony labyrinth above the cochlea. So this is called the labyrinthine segment. It then takes a bend or a genu here, sharp turn, where it synapses with the geniculate ganglion. And it then courses its way through the tympanic cavity here. Labyrinthine segment, anterior genu, greater superficial petrosal nerve, tympanic segment. And in this segment, we can see here that it courses under the lateral semicircular canal. After it courses the tympanic cavity, it will then produce another bend downwards here. And this is called the posterior genu. So let's take a look again. Intraaxial, cisternal, enters the IAC, courses above the cochlea, called the labyrinthine segment, bends anteriorly. It bends in the anterior genu, giving off the greater superficial petrosal nerve at the geniculate ganglion, enters the tympanic cavity under the lateral semicircular canal, and produces a bend called the posterior genu. After the posterior bend or genu, it descends within the mastoid temporal bone as the mastoid segment. This one, mastoid segment. And then it exits the stylomastoid foramen to become the extracranial segment. So let's take a look at our model here. So taking a look at the side view, we see the mastoid segment here and the extracranial segment. The mastoid segment is shown in the diagram here with two branches, a green one and a more distal yellow one, represented here on the left with the same color, the green and the yellow one. The green one will supply the stapedius muscle, which will cause hyperacusis when there's a dysfunction. While the yellow one, this one, yellow, represents the chorda tympani, the problem of which would cause loss of taste to the anterior two-thirds of the tongue.